Good morning. Welcome to Health and Human Services, full committee. I'm your chair, Delegate Rodney Willard. Thanks for being with us this morning. We've got a couple of bills for the full committee and then some very significant reports from our chairs of the subcommittees. And we'll start by taking the roll.
I'm closing it.
I think. Get two more coming right now. So hold this 1 second. Just start. So we're just taking one. Yeah.
I'm going to do it again.
Yeah.
Okay.
Actually, we're going to do that. You should. Okay. No. Well, if it's already up, we'll do it again. Sorry. Double count. Double count. Okay. Okay. We've got a quorum twice. We're good. We're going to do a couple bills before the full committee, and we're going to start with HB 1478 from Delegate Davis, who has asked us to strike that bill. And I would welcome a motion to that.
So moved.
We have a motion that's been properly seconded to strike HB 1478. We'll go on the board. Thank you. And by a vote of 17-0, we have voted to strike HB 1478. Next up, we have House Bill 1115 from Delegate Navarre. Yeah. Nope.
No, she's right there.
She's right.
I was like, what?
False alert. False alert.
It's really early.
That's good. You're good.
Oh, I missed that.
That,
Whew.
that was just a test. Come on up. Thank you.
As you know, Mr. Chair, I already had that last night.
That's right.
Yeah, so.
I'll say in defense of the patron and my co-chair, when the agenda shows up online, it lists the bills to be stricken. And then it has the full agenda for the Health and Human Services and list the bills to be stricken. But if you look at it quickly, you would say, oh, all those bills are being stricken. So I made the same mistake. So
I did too.
No,
I didn't read.
It is misleading.
All
But thank
right.
you for being here.
Okay. So, Mr. Chair and members of the committee, thank you for the opportunity to present House Bill 1115, which ensures that non-emergency medical transportation providers disclose their fees up front. I also have an amendment in the nature of a substitute.
All in favor? Aye. Any opposed? The substitute is before us.
All right. Just to explain the substitute real quickly, it clarifies that disclosure isn't required when a state medical assistance plan like Medicaid or Medicare covers the service, simply because those patients have no out-of-pocket costs. And the substitute also provides clearer guidance on what information must be shared and how. So speaking to the bill, HB 1115 is about transparency. When Virginians use non-emergency medical transportation, whether for dialysis, rehab, or transfers between facilities, they deserve to know the cost before the ride, not after an unexpected bill shows up. Without upfront disclosure, patients have no way to understand or prepare for what they may owe. These costs can vary widely based on distance, the type of vehicle or equipment, the level of care needed, the region, and a patient's insurance coverage. This bill simply requires providers to give patients or their representatives a clear written disclosure of all fees, including total out-of-pocket costs, and to note that the amount reflects the cost without insurance. Providers can share this information in any reasonable way. For example, a provider's website could post mileage-based rates, or a hospital could hand patients a brochure or rate sheet when arranging transport. And importantly, this bill does not affect emergency transportation. Urgent care remains urgent. HB 1115 is a simple, common-sense step to protect patients and make costs clearer without creating extra work for providers. I respectfully ask for your support.
Delegate Navarre, thank you so much. I'm going to start with the committee to see if we have any questions for you. We'll go to Delegate Dr. Downey.
Thank you, Mr. Chair. A question for the patron.
Yes.
Please.
So do hospitals that offer these non-emergent, do they have multiple providers that people can get quotes from different providers to select the one that's less costly?
Mr. Chair, to answer the delegate, hospitals generally have contracted providers, and so if there are more than one, what I would like to see is that there are multiple rate sheets available to give the patient the choice. Now, in some cases, they may not have a choice. That may be the only option available to that patient. However, what this does is it allows the patient to have something, and that is then up to the patient to decide to make an informed decision on whether or not to take it. And in most cases, they have no choice, but at least there's full disclosure.
Thank you.
Thank you. Delegate Cornett.
Thank you, Mr. Chairman. I guess my concern with this is, say we have a patient at a nursing facility that goes for dialysis, for example, like 3 times a week. So that's actually 6 transports per week, 1 to the facility, 1 back. And so will they be required to disclose this every transport, even though it's a normal thing that happens 3 times a week?
Mr. Chair, to answer the delegate, that's a very good question, very good scenario. I would say that is, if that is a recurring arrangement, then I would say that should not happen that way. But that's what this bill will give some flexibility to how that is. This is just about give the upfront rates, and then how that arrangement is done, whether it's recurring or not, that is up to the patient to work out with the provider. But yeah, I would find that very cumbersome if you had to do that every single time, especially if the rates are the same.
Thank you. Delegate Cohen.
Thank you, Mr. Chair. Question for the patron.
Please.
I think in reading this bill, my only question was that I know often people are required, they can't just drive themselves often when the hospital is saying it's a non-emergency transport. And so if you were given this cost estimate and it is quite large, what would your alternatives be if there aren't other ambulances available or non-emergency transportation? I think my only worry was if the hospital is saying, I'm sorry, like you can't drive yourself, what are your options that are left?
Mr. Chair, to answer the delegate, in my similar response to Delegate Downey, right now there is no choice anyway in that same scenario. But the difference is at least you go in with your eyes wide open of what the potential total out-of-pocket cost would be, so that you don't end up with a surprise, unexpected bill months later. And I do have a witness here who that had happened to, which is what prompted this bill.
Thank you. We've got a couple more questions for you, Delegate Navarro, but just trying to understand the question for me, just trying to understand the spirit of the bill. Right now, if you are a patient and you've been told you need to get an MRI, is it my understanding that you have that the cost of that MRI is disclosed to you as a patient? See, in the spirit
Mr.
of
Chair.
No. What I'm trying to just by analogy, when you go in for medical services, we have disclosure laws already that affect other medical services. This is the transportation part of that.
Right. This is specific to NEMTs, for which right now there is nothing on the books for disclosure. And that's what this bill is trying to do, which is to provide more disclosure up front. There are some counties and cities that are doing this proactively, but this is really targeting the more private areas where it's a bit of a wild, wild west.
Okay. Delegate Hodges.
Thank you, Mr. Chairman, and thank you for bringing the bill. I understand the issue, but when Delegate Cornett asked his question, you said that would be, when the patient would work with, the transportation company on how that would work. But the legislation doesn't actually do that. It's actually more restrictive than permissive, and it imposes a requirement for each time. Would be my concern, because it says that they shall do this, and it is actually more prescriptive really more restrictive than permissive. So it doesn't give any latitude there to be able to do that with the shall.
Shall include, to answer the delegate, disclosure shall include a statement indicating that the total out-of-pocket costs for such transportation services. I didn't get into the specificity of that simply because I think in the way I was envisioning that kind of scenario, which is if there is a recurring schedule, then I would like to think that the provider and the patient will have had a statement, again, for transparency for the patient, this is what it's going to cost at every single trip. That is what the intent of this bill is just to provide transparency.
Okay, thank you. And Mr. Chairman, just to follow up, and I think the language, and if I may, and it would be, maybe council can weigh in on that, but I don't think your intent versus what the actual language is doing, it reaches your goal.
I'm open to suggestions from council.
Mr. Chair, Delegate Hodges, there is, if you notice in the substitute at the bottom, it does add that the provider may make such disclosure through a method reasonably expected to provide advance notice to patients. And it lists out, includes, a brochure, an invoice, or a website. So, as long as the method is reasonably expected to provide advance notice, then it would satisfy the requirements of the bill. That would be something like a rate sheet on a website. As long as it, discloses that rate and it's reasonably expected to provide the patient with advance notice, it should satisfy the requirements of the bill.
Thank you for the question.
Vice Chair Tran.
Mr. Chair, I have a question for council. Mr. Chair, I have a question for council.
Please.
Council, do we define out-of-pocket costs anywhere in the code?
Madam Chair, I don't believe there is a definition for out-of-pocket costs that we use in the code. We have used the term out-of-pocket costs before in the code without defining it, and plain meaning is what controls in that situation, so it would be the same situation here.
Follow up, Mr. Chair. Council, do out-of-pocket costs, then how we use it in layman's terms, are they limited to the costs that insurance policies would not cover?
Madam Chair, there is a provision in the bill that addresses this where it says that the disclosure has to include a statement indicating that the total out-of-pocket cost for transportation services provided included on the disclosure reflects the cost without insurance. So that statement should be included on the disclosure that that's required to be provided under the bill.
Council, this is a question from both of us in the chair. Is that in the substitute, the last part you're reading? Yeah, that's in the substitute. Oh, okay. Sure, look at the same thing. I know we've got a couple of witnesses, I believe, Delegate Navarro, so if you want to go to your witnesses, and we can certainly ask more questions as we go through.
Is Misty here?
Come on up.
Good morning,
Good morning.
everyone. Thank you for having me here with you. I am a Virginia parent and constituent of patron May Navarre, and I'm here to explain why I believe that this bill is needed. In April of this year, 2025, my son required interfacility ambulance transfer after he tested with critically elevated cardiac markers. The hospital did not have the means to treat him because he was a pediatric patient, and it was medically necessary and time sensitive to transfer him to VCU. And even though it was sensitive, he was classified as non-emergency on that ambulance. Despite the seriousness of this situation, my family received no information about the cost, the billing, or even options to look for providers. And so therefore we had no ability to know what was going to happen down the line. So 5 or 6 months later, we received a bill that was an estimated of $2,700, which completely took me off guard. $500 of it was covered by my health insurance. I have really great health insurance. And so a little over $2,100 is currently on me to pay for. When I contacted my insurer thinking that there had been a mistake, I was told that non-emergency ground ambulance services are largely unregulated, and that surprise charges and surprise bills are often very common. So I believe that this bill addresses that gap. What families are told, when families are told that transport is necessary but not labeled as an emergency, they're still left without meaningful choice or transparency. Clear disclosure and accountability will protect Virginia families from unexpected financial harm during already very stressful moments. So thank you so much for this consideration, and I hope you all have a wonderful day. Thank you.
Thank you so much. Anyone else to speak? That was, of course, in favor of the bill. Anyone else speaking in favor of the bill? Anyone to speak against the bill? If we get a couple folks, if you can keep your comments to a minute, that would be, to less than a minute, that would be great. Thank you. Come on up.
Mr. Chairman, Ed Rhodes with Virginia Ambulance Association. We appreciate the time and effort that the delegate has put into this substitute and meeting with us. The president of the Ambulance Association wanted me to convey to you her comments, and I'll be very brief. She says, what we are now proposing effectively forces a parent to choose between accessing necessary higher level care for the cost of their child and facing a significant financial burden. Basically, she's also saying that you're not going to see an invoice or anything if the insurance does not pay it from $3,000 to $5,000. We would like to continue working with the delegate on this, maybe for another day, and see if we can work out any details with it. We're not opposed to it in theory because it does stop the surprise billing, but we want to be able to work one more day on it if possible. Thank you.
Hello, I'm Dr. Sheila Fury. I have some significant concerns about the non-disclosures if the amount is covered in full. I think no matter if it's covered in full or not, this opens it up to fraud, and insurance companies or other entities, Medicaid, Medicare, paying the whole cost of this, and the ambulance service or whatever service is providing this is jacking their fees because they know that it isn't going to be audited.
Okay.
Mr. Chairman.
Anyone else? Yes.
Mr. Chairman, I've heard some, obviously I've heard the problem, and I'm glad the delegate brought this bill because this is a problem. This reminds me of the surprise billing law that we worked on, but also the helicopters coming for emergency and having those full disclosures. And I think that we should put this into subcommittee, so I would move that we take this bill by for the day, and we can work on this because it sounds like everyone identifies that this is a problem, and I appreciate you bringing this forward, but we got to figure out a solution to get us there. And so that would be my motion, Mr. Chairman.
Second.
We've got a motion that's been properly seconded to take this bill by for the day. All in favor say aye. Aye. Any opposed? No, okay. So Delegate Navarre, thank you so much. I think you're close, and I appreciate the comments and questions today. And I do think the comment I was making, or the question I was making, I do think this is analogous to what we already do, no surprise billing with other medical matters, and I think that's the theme here and the philosophy here. And if we can get the details to reflect that, I think we'll have a good bill. So we'll give you another day or two here, and look forward to seeing you back.
All right. Thank you very much.
Okay, we're going to pivot to our committee reports and start with Chair Price, who has the behavioral health. I'm sorry, I said that exactly wrong. We're going to go to Chair Gardner and start with the behavioral health subcommittee report.
Thank you, Mr. Chair. For behavioral health, we will start with House Bill 225. The patron is Delegate Hope, And what House Bill 225 does is requires that the Department of Behavioral Health and Developmental Services to convene a Marcus Alert Evaluation Task Force to assist in determining the effectiveness of the Marcus Alert system. This bill is a recommendation of the Behavioral Health Commission. The subcommittee recommended reporting by a vote of 7-1, and I so move.
Second.
Yes, I believe we have an amendment. I heard a motion to move the amendment. Second, all in favor of that amendment, say aye.
Aye.
Any opposed, no. So Deborah Gardner, Delegate Gardner, if you could give us another motion on that with the amendment, I think we'll be good to go.
I would move that the committee reported the bill by 7-1, and I so move. With amendments.
As amended.
With amendments.
Okay.
Mr. Chair?
Yes. I have a question.
This was recommended reporting and referring to appropriations. Is that the appropriate pathway, or has that changed since committee?
It does not need to go to appropriations, but thank you for asking that. Okay, so we have a motion to approve House Bill 225 as amended. We'll go on the board. And House Bill 225 carries by a vote of 19-0 as amended.
Next, we have House Bill 309, which provides that while seeking the insurance of an order for temporary detention in hospital for testing, observation, or treatment, or an extension of such order, the person who would be subject to such order and is currently subject to an order issued pursuant to the current law shall remain in the custody of the facility where he is located, and any security personnel shall ensure that such person does not leave the facility while such person is unable to provide informed consent. The bill states that the person shall be permitted to leave the facility if such order is not issued. The bill also provides that any licensed health professional or licensed hospital, including a hospital licensed by the Department of Health pursuant to the relevant law, shall have no liability arising out a claim to the extent the claim is based on the lack of consent to the detention of a person when such professional or hospital is seeking the court's or the magistrate's authorization for such detention. The subcommittee recommended reporting with a substitute on a vote of 8-0, and I move the substitute.
Actually, we got a motion to approve the substitutes, not properly seconded. All in favor, say aye.
Aye.
Any opposed? No.
I move the reporting of 8-0 with the substitute.
Second. We have a motion that's been properly seconded to approve HB 309 with substitute, and we'll go on the board.
House Bill 513.
One sec.
Sorry,
One sec.
go on the board.
Chairman's rolling.
I'm overzealous today.
Okay, and HB 309 with substitute passes by a vote of 19-0, and now we'll get on to 513.
Okay, House Bill 513 by Delegate Martinez. It provides that we add to the list of purposes for which local and regional overdose fatalities review teams may be established the purpose of reviewing the overdose-related deaths by suicide of veterans and military service members. The bill further adds a local representative to the Virginia Department of Veterans Services to the list who may be on the local or regional teams, and it reported with a substitute. I move the substitute.
Second.
We have a motion to move the substitute that's been properly seconded. All in favor, say aye.
Aye.
Any opposed? No? Okay.
It was a recommendation to report with a substitute of 8-0, and I so move.
Second.
We have a motion that's been properly seconded to report HB 513 with substitute, and we'll go on the board. And HB 513 passes by a vote of 19-0.
And lastly, Mr. Chair, we have H-Bill 681, bill by Delegate Hayes, which clarifies that the term law enforcement officer as used in relevant law relating to emergency and involuntary civil admissions include retired law enforcement officers defined in the bill for the purpose of laws related to emergency custody and involuntary and temporary detention. The committee recommended reporting 8-0, and I so move.
Second. We have a motion to report HB 681, and we will go on the board. And HB 681 passes by a vote of 19-0. Chair Gardner, thank you so much. Now we will get to Chair Price for the Health Professions Subcommittee report.
Thank you. Mr. Chair, we have House Bill 156 by Delegate Krisak, and I would move the substitute.
Second.
We have a motion that's been properly seconded to remove the substitute for HB 156. All in favor, say aye. Aye. Any opposed? Great. That's before us.
So as with the substitute, it directs the Board of Medicine and Board of Nursing in collaboration with the Virginia Office of Vital Records to establish continuing education requirements on the electronic death registration system and require an attestation on the requirements of the timely signing of death certificates from physicians and advanced practice registered nurses authorized to practice independently. This bill is to help doctors follow the law and have more doctors to use the system and help the remains be processed quicker. This was recommended to be reported with substitute on a vote of 9-1, and I so move. Oh, excuse me. It was recommended to be reported with substitute and referred to appropriations. Appropriations said they no longer need it, so I would like to change that motion to report with substitute.
Second.
We have a motion that's been probably seconded to report with substitute HB 156. We'll go on the board. And HB 156 carries by a vote of 19-0.
Mr. Chair, I have your House Bill 452, and I believe you have an amendment.
Yes, thank you so much, Madam Chair. I have an amendment. I'll get the council to describe and report that.
Mr. Chair, this amendment adds a sunset to the bill on July 1st, 2029.
Madam Chair.
I move the amendment.
Second.
All in favor?
Aye.
Any opposed? No. Madam Chair, just for 1 second, I'm just going to describe that amendment. We appreciate we got some feedback on the legislation. I think there's unanimous agreement that we need to do more to get more rad techs working, and this bill certainly does that. But there was some question about with more people, more rad techs being able to take advantage of this non-licensed requirement, would that create any issues? So we put a sunset on this, which will let us revisit this in a couple years. Obviously, if there was a problem before, then we could certainly do that. There has not been a problem to date with the folks who are working through hospitals. This expands that area, and that's the gist of the amendment. And I do see a question, since I've got the board here, from Delegate Waxman.
Thank you, Mr. Chair. If I could speak to the bill.
Please.
I did have a chance to review some of the comments from the subcommittee, and I did go back and review the subcommittee testimony. I've just got some concerns about this as ionizing radiation, and when it goes out into the smaller community practices, I've got some concerns about the non-licensed rad techs out there having the general knowledge of when radiation is too great and how to protect themselves. So I'm afraid I'm going to probably be in the negative on this vote. Thank you.
Oh, okay. So the subcommittee recommended reporting 9-0-1, and so I would move that we report with amendment. Oh, wait. I'm sorry. I can't make the amendment.
Mr. Chair, I would like to motion that we report as amended.
We have a motion that's been properly seconded to report HB 452 as amended, and will go on the board. And HB 452 reports by a vote of 11 to 6. Thank you.
Thank you. And now we have House Bill 465, patroned by Delegate Cohen. And this amends the composition of the Advisory Board on Behavior Analysis to require that 3 members shall be licensed behavior analysts or licensed assistant behavior analysts who have practiced for at least 3 years. And this is a technical fix to help fill an open slot from 2021. The subcommittee recommended reporting on a vote of 10 to 0, and I so move.
We have a motion. It's been properly second to report HB 465, and will go on the board. And HB 465 reports by a vote of 18 to nothing.
Now we have House Bill 815, and I would move that this bill go by for the day.
Second. We have a motion that's been properly seconded to take HB 815 by for the day. All in favor say aye.
Aye.
Any opposed? That's by for the day.
House Bill 841, I also move that we would take by for the day.
Second. We have a motion that's been properly seconded to take HB 841 by for the day. All in favor say aye.
Aye.
Any opposed? HB 841 is by for the day.
So now we have House Bill 1116 by Delegate Navarre, and I would like to move the substitute.
Second.
We have a motion to moving the substitute. It's been properly seconded. All in favor say aye.
Aye.
Any opposed?
And now with the substitute, this bill directs the Department of Health to establish a nursing home information portal and the Department of Social Services to establish an assisted living facility information portal to consolidate publicly available information on nursing homes and assisted living facilities respectfully. The bill requires operators of nursing homes and assisted living facilities to submit a quarterly report to the Department of Health or the Department of Social Services respectively with information on incidents involving emergency medical services. This information is already tracked and the portal is available. The subcommittee recommended reporting with substitute and referring to appropriations on a vote of 9 to 1, and I so move.
We have a motion that's been properly seconded to report with substitute and refer to appropriations HB 1116, and we'll go on the board. And HB 1116, by a vote of 16 to 3, will report with substitute and be referred to appropriations.
House Bill 1139 removes the requirement that the Board of Medicine have 1 physician from each congressional district and instead requires that 11 physicians are on the board. The bill removes references to change of residence provisions for physician board members. This is a cleanup bill from an outdated requirement as other boards do not have this requirement. The subcommittee recommended reporting on a vote of 9 to 1, and I so move.
Second. We have a motion that's been properly seconded to report Bill HB 1139, and we'll go on the board. And HB 1139 reports by a vote of 18 to 1.
House Bill 1147, patroned by Delegate Hayes, has a substitute. I move the substitute.
Second. We have a motion that's been properly seconded for substitute for HB 1147. All in favor say aye.
Aye.
Any opposed? Now the substitute is before us.
With the substitute as part of the Momnibus and from the Committee on Rural Health, this directs the Board of Medicine and Board of Nursing to require certain licensees to complete continuing learning activities on bias reduction in healthcare as part of their continuing education and continuing competency requirements for licensure, and authorizes the Board of Nursing to require certain continuing learning activities or courses in a specific subject area. The subcommittee recommended reporting with substitute on a vote of 9 to 1, and I so move.
Second.
Mr. Chair.
Thank you. We do have a question from Delegate Griffin.
And Mr. Chair, may I speak to the bill when appropriate?
That would be appropriate now. Thank you.
Mr. Chair, this got a little bit heated in subcommittee. I just want to say I don't think our doctors are racist. I don't think our nurses are racist. And I think it's wrong for politicians to act as if they are in a moral position to require doctors and nurses to get bias and racism training. We should be past this. This is divisive, and that's why I'll be voting against it. Thank you, Mr. Chair.
We've got, let's go to Chair, Delegate Herring first.
Thank you, Mr. Chair. Speaking to the bill.
Please.
Mr. Chair, this is not about racism. This is about bias and healthcare bias. This is about making sure that physicians and those in the health profession understand that patients are different. We present differently with ailments, and sometimes, for example, with pain thresholds, it's assumed that a certain patient can have withstand a different pain. So I just think we need to get our heads out of the sand and realize that there's better health outcomes when people in the medical field get bias training. Thank you, Mr. Chair.
And then we have Delegate Scott.
Thank you, Mr. Chair. Speaking to the bill.
Please.
I understand the need for bias training. My daughter has trisomy 18. That's not anything unfamiliar with many of the folks in the audience or on the committee. And some of the times it was a challenge to get doctors to look beyond her condition and just look at her as a patient versus a child with trisomy 18 that wasn't going to live, right? She's going to be 7 next year, or later this year, I mean. And so she's had a longer life than expected because there were some providers that were willing to look beyond her condition. So I understand the need for such training. However, this past year I had a piece of legislation to look at some of the trainings that we've put on various professions throughout the Commonwealth to see if they're needed on an annual basis or every other year. And so with great hesitancy on adding more to the plate, and I, again, understand the need for bias training, I will be voting against this because I think that there are other ways that we can meet this need so that we're providing the care that the individual needs versus just giving a blanket approach of, oh, this child has trisomy 18, they're not going to live, because those outcomes have changed and shifted over the years. And so I would hope that this committee and other boards and commissions in the off session would look at the trainings that are being required of all these different professionals across the Commonwealth and see what can be consolidated and combined. And so again, for that reason, Mr. Chair, I'll be voting against the bill.
Delegate Hayes.
Thank you so much, Mr. Chair. Speaking to the bill, please. Mr. Chair, there are a lot of thoughts that I have in regards to this bill, but I'll just mention a few. In the spirit of thinking about a popular phrase from Dr. King, he reminded us that true progress does not come rolling in on some wheels of inevitability. It takes hard work, it takes sacrifice, it takes change, pushing to make a difference. Another point I want to make is that in the evidence that we've seen by these differences, these biases, and the disparities in the outcomes equates to, in a lot of ways, policy violence and policy murder. I'm not exaggerating when I say that. You'll know that in this legislation, we have also this year included sickle cell. There's a large part of our medical community that just does not know, they're not aware about this disease. And so it's important for us to educate everyone about the differences and the outcomes that we are seeing. That concludes my remarks, Mr. Chairman.
Thank you. We have a motion that's been properly, Delegate Waxman.
Thank you, Mr. Chair. I had a question. We require mandatory continuing education credits for relicensure for nurses and pharmacists and physicians. I don't know that this question's been brought up, but will this bias training go towards those minimum requirements for relicensure? Would this be on top of those requirements? I know that currently anybody that bills CMS for Medicare, they have to go through cultural awareness training that is not part of the mandatory continuing education credits. And that's why I am a little bit concerned as we keep adding more educational requirements to the health professions. Is this going to get credit for their mandatory CE, or is this in addition to that?
If we have anyone from health professions who could speak to that question, I can't answer that. Aaron's. Yeah. Thanks, Aaron. Come on up.
Good morning, Mr. Chair, members of the committee. Aaron Barrett on behalf of the Department of Health Professions. My understanding of the bill, the substitute that the committee is reviewing, the continuing education would be part of annual or biennial continuing education requirements for these professions.
Thank you so much. So we have a motion that's been properly seconded to report HB 1147 with substitute, and we'll go on the board. And HB 1147 will report with substitute by a vote of 14-6.
House Bill 1287, patroned by Delegate Cohen, has a substitute, and I move the substitute.
Second. We have a motion that's been properly seconded to introduce a substitute for HB 1287. All in favor say aye.
Aye.
Any opposed? Okay.
So with the substitute, this bill requires the Board of Veterinary Medicine to amend its applications for licensure and renewal to include a method for applicants to indicate their interest in serving as a veterinarian of record, as that term is defined by the bill. This bill requires the board to maintain a list of interested applicants that is accessible to representatives of shelters or other animal welfare organizations through its website. This is in an attempt to help lessen the time that animals have to wait in the shelter to be, added to their new family. The subcommittee recommended reporting with substitute on a vote of 10-0, and I so move.
Second.
We have a motion that's been properly seconded to report with substitute HB 1287, and we'll go on the board. And HB 1287 will report with substitute by a vote of 19-0.
We now have House Bill 1332, and this is with Delegate Anthony, and it directs the Department of Health to establish the Regional Care Compacts Pilot Program to permit healthcare entities to enter into compacts as defined by the bill to incentivize healthcare workforce development. The bill permits such compacts to engage in workforce development activities, pool resources, enter into agreements with other entities to expand training and placement capacity, establish shared goals, and share workforce data in accordance with applicable privacy laws. This builds a framework for workforce development coordination. The subcommittee recommended the bill be reported and referred to the Committee on Appropriations on a vote of 10-0, and I so move.
We have a motion that's been properly seconded to report and refer to appropriations, HB 1332. Go on the board. And HB 1332 will report and refer to appropriations by a vote of 20-0.
And lastly, Mr. Chair, we have House Bill 1357. And this, patron by Delegate McQuinn, and this bill directs the Virginia Department for Aging and Rehabilitative Services to convene a work group of relevant stakeholders for the purpose of conducting a comprehensive study of the quality of care, resident safety, and operational practices of nursing facilities in the Commonwealth. The bill directs the department to submit the work group's findings and recommendations to the chairs of the House Committee on Health and Human Services and the Senate Committee on Rehabilitation and Social Services by November 1st of this year. This bill is a deeper dive into accountability to help lift Virginia from being ranked the worst. The subcommittee recommended the bill be reported and referred to the Committee on Appropriations on a vote of 10-0, and I so move.
We have a motion that's been properly seconded to report and refer to appropriations HB 1357. Go on the board. And HB 1357 reports and refers to appropriation by a vote of 20-0. Thank you so much, Chair Price. And now we will pivot to Chair Tran for the Social Services Subcommittee report.
Thank you, Ms.
Oh, sorry about
that. Thank you so much, Mr. Chair. Before us, we have House Bill 37 from Delegate Shin. This bill repeals the July 1, 2026 sunset on provisions directing the Department of Medical Assistance Services to disregard Social Security disability insurance income above the maximum monthly supplemental security income when determining financial eligibility for developmental disability waivers. The subcommittee recommends reporting by a vote of 8-0, and I so move.
We have a motion that's been properly seconded to report HB 37, and we'll go on the board. And HB 37 reports by a vote of 18-0.
Thank you, Mr. Chair. We have House Bill 66 before us, and I have a substitute that I would like to move.
Second. We have a motion that's been properly seconded for substitute of HB 66. All in favor say aye.
Aye.
Any opposed? And the substitute is before us.
House Bill 66 from Delegate Feggins directs the Department of Medical Assistance Services and the Department of Social Services to modernize the technological systems they use to administer federal medical assistance and social services programs to meet all eligibility determination, certification, data reporting, or other requirements for those programs. Further, the departments must submit an implementation plan for the new modernized tech system to the governor and the chairs of the House Committee on Health and Human Services and the Senate Committee on Education and Health by December 1, 2026, and provide quarterly reports to the General Assembly after. The subcommittee recommends reporting with substitute and referring to appropriations by a vote of 7-1, and I so move.
Thank you. The motion is probably before us. We do have a question from Delegate Scott.
Yes, Mr. Chair, question on the bill. Will this have any impact in a positive way for the local departments of social services, or is this just state level?
Mr. Chair, we did not address that specifically, but I see that Mr. Carl is here.
Come on up.
Good morning, Mr. Chair, and to the delegate is absolutely what this does is it sets forward a plan to replace the outdated technology that does the eligibility determinations for the 2.5 million plus Virginians. So this is the next appropriate step to actually get the funding and move us towards replacing that system.
Thank you. Thank you. And then one
Thank you, Mr. Chairman. I know
I'm sorry.
Although my locality will be very happy for this to start that process because they've been begging for a new system for a long time.
Yeah. No, thank you. And then Delegate Waxman.
Maybe a somewhat related question while the gentleman is still standing. Is this all going to be changes internal within the department, or will our providers need new software or different standards to be able to interact with the system as well?
Yes, Mr. Chair, and to the delegate, this is the internal eligibility system, but there are a number of APIs that touch all sorts of different systems. Additionally, DMAS has a separate system that deals with the providers directly. That's why this is a DMAS and DSS conversation as a whole. The main system that we're talking about here is what's called Virginia Case Management System, which is what the 120 local departments use to determine eligibility for our constituents across the Commonwealth. That's the system that we were really talking about here, but it touches a number of individuals, and we have to figure all that out through the study process.
Thank you, Mr. Chair. With that answer, does that mean it will impact how providers interface or not?
Mr. Chair, and to the delegate, we don't know yet from that end of it, because as of right now, everything is paper. So I just want everybody to understand what we're talking about here. We serve 2.5 million Virginians that they get all their notices via paper, and the provider community that has any touching on this is from the Medicaid side through their MES system. If you're going to modernize the system, we have to move it to a place to where you have those technological connections from the constituents and from the provider community. So that will be part of what will be laid out. Right now, that does not happen, but that's part of what has been in the 2023 study that did this. We did a 2024 study that looked at this. Now this will be the 2026 version to update all those different pieces. But we have 2 versions we've already done to move this, and then this will be an updated version of that.
Thank you, and thank you, Mr. Chair. I appreciate the answer. As we move forward, I do hope that we give some considerations to our providers to try to minimize that impact, because they also have certain standards that they use for everybody else, and I would hate for our state to make this a different interface than what our providers are accustomed to. Thank you again, sir.
Yes, sir.
Thank you. So we have a motion that's been properly seconded to report with substitute and refer to appropriations, HB 66, and we'll go on the board. And HB 66 will report with substitute refer to appropriations by a vote of 20 to nothing.
Thank you, Mr. Chair. We, for House Bill 87 from Delegate Lawfer, the subcommittee recommends incorporating that bill into House Bill 1284 from Delegate Downey, which I will speak to later on this morning, and I so move.
We have a motion that's been properly seconded to incorporate HB 87 into HB 267. That's a voice vote. All in favor, say aye. Aye. Any opposed? That's been incorporated. Thank you.
Thank you, Mr. Chair. Next before us, we have House Bill 267 from Delegate Tata. This bill directs there is a substitute I would like to move.
There's a motion that's been properly seconded for a substitute for HB 267. All in favor, say aye.
Aye.
Any opposed? That's before us.
This bill by Delegate Tata directs the Department of Medical Assistance Services to seek the necessary medical approvals to increase as necessary based upon Social Security Administration cost of living adjustments, the earned income disregard for workers with disabilities. The subcommittee recommended reporting with substitute and referring to appropriations by vote of 8-0, and I so move.
I had an alternative motion for that I wanted to make for.
Okay.
Just to take that bill by for the day.
Okay.
That's okay. We have a motion that's been properly seconded to take by HB 267 for the day. All in favor, say aye. Aye. Any opposed? Okay, we'll take that by for the day. Thank you.
All right, House Bill 425 from Delegate Lavier Bowling. I would like to move the substitute.
Second. We have a motion that's been properly seconded to approve a substitute for HB 425. All in favor, say aye. Aye. Any opposed? No. We have the substitute.
This bill expands the provision for payment of medical assistance for remote patient monitoring services provided via telemedicine to include all pregnant and postpartum people. Under current law, only high-risk pregnancies are covered. The subcommittee recommends reporting with substitute, referring to appropriations by vote of 8-0. And I so move.
We have a motion that's been properly seconded to report with substitute and refer to appropriations, HB 425. Go on the board. And that bill reports with substitute to appropriations by a vote of 19-1.
Mr. Chair, we have House Bill 470 from us. We have House Bill 470 in front of us from Delegate Cohen. This bill directs the Department of Medical Assistance Services to modify the program rules for consumer-directed services available through certain Medicaid waivers to allow an individual receiving services to serve as employer of record for his own service delivery and designate another individual to perform all or a portion of the duties of the employer of record on the individual's behalf when the individual receiving services is unable to perform such duties or direct their own care. And it has a couple of other requirements as well that help support that implementation. The subcommittee recommends reporting and referring to appropriations by a vote of 8-0, and I so move.
Second. We have a question from Delegate Griffin.
Yes, Mr. Chair, question.
Please.
In reading this, does this take away the Medicaid, a work requirement, and instead say that the person on Medicaid can certify themselves with no oversight that they are working for themselves instead of having an employer sign off for them?
Delegate Cohen is present, Mr. Chair. I don't know if she would like to take that.
Delegate Cohen.
Mr. Chair, I would answer the delegate that no, that's not how consumer-directed services work. So this is just, you have to have an employee of record so that you have a federal EIN number so that the people who provide care for you can be paid. And so this makes sure that there's no lapse in that payment and no lapse in care for people who rely on our consumer-directed services.
Mr. Chair, follow up?
Okay.
Again, waivers to allow an individual receiving services to serve as like his own employer of record? Is that not, are they not, my question is the person on Medicaid now serving to sign their own document where they were not before?
Mr. Chair, I'd be happy to answer.
Yes, please, Delegate Cohen.
I would say that just remember there's a difference between, I would say to the delegate, a difference between employer and employee. This is allowing a person to serve as the employer of record for people who are employees delivering care.
Thank you, Mr. Chair.
Thank you. We have a motion before us that's been properly seconded to report, refer to appropriations, HB 470, and we'll go on the board. And HB 470 reports and will be referred to appropriations by a vote of 19-1.
Mr. Chair, now we have House Bill 823 from Delegate Carr before us. I'd like to move the amendments.
We have a motion that's been properly seconded to report amendments to HB 823. All in favor say aye. Any opposed? We have the amendments before us.
Thank you so much, Mr. Chair. This bill directs the Department of Medical Assistance Services to seek the necessary approvals to amend the program rules for the Community Living and Family and Individual Supports waivers to provide for compensation of a direct support professional for a waiver recipient in an acute care hospital under certain circumstances. The subcommittee recommends reporting with amendments and referring to appropriations by a vote of 8-0, and I so move.
We have a motion that's been properly seconded to report and refer to appropriation, report with amendments and refer to appropriations HB 823, and we'll go on the board. And HB 823 will report with amendments and to be referred to appropriations by a vote of 20-0.
Mr. Chair, next before us, we have House Bill 855 from Delegate Cousins. This bill directs the Department of Medical Assistance Services to limit the operation of its state recovery program to the recovery of only federally required costs. The bill directs the department to make information on estate recovery available on its website in multiple language, and it directs the department to adopt emergency regulations to implement the provisions of the bill. The subcommittee originally recommended reporting and referring to appropriations, but it turns out that we do not need to go upstairs. So I'd like to move that we report and report. And that was on a vote of 7-1.
Thank you. And we do have a question from Delegate Griffin.
Mr. Chair, may I speak to the bill?
Yes.
Mr. Chair, I don't think this is a bad idea. I spoke about this on the floor the other day. I do think that in the United States of America, we should speak English, and the policy of our government should be that all policy is published in the English language. So whenever I see anything about multiple languages, I think that's a mistake. I think it prevents people from being able to achieve the American dream, because when they don't learn the English language, it makes it harder for them to really become a part of the community. It keeps them as outsiders, and I think that the best way to move forward is for our government to set forward a positive policy where we all speak the English language. I think that is reflected in the President's executive order. So I see that in the, I'm a little bit unclear about where that's at in the PDF that I looked at, but I see it in the analysis of the bill. So for that reason, I'm going to be voting no. Thank you.
We have a motion that's been properly seconded to report HB 855. We'll go on the board. And HB 855 reports by a vote of 16-4.
Mr. Chair, we have 3 more bills. We were a very prolific subcommittee last week. House Bill 879 from Delegate Shin is in front of us. This bill requires the Commissioner of Social Services or a local director of social services to make a public notice available on the Department of Social Services website within 10 days of receiving a request for a record of information concerning 25 or more applicants for or recipients of public assistance or child support for a purpose not directly connected to the administration of those programs. The bill establishes the form of the public notice and requires those notices to be made available, regardless of whether such information has been previously shared, regardless of the identity of the requester, unless the request is permitted under existing law, and even when a request is made in compliance with state and federal law and regulations. The subcommittee recommended reporting with amendments by vote of 6-2. I'd like to move the amendments first.
We have a motion that's been properly seconded to amend HB 79. All in favor say aye. Aye. Any opposed?
Mr. Chair, I would like, the subcommittee recommends reporting with amendments by a vote of 6-2, and I so move.
We have a motion that's been properly seconded to report as amended HB 879, and we'll go on the board. And HB 879 is amended, reports 14-6.
Mr. Chair, House Bill 1240 from our Uber Chair yourself. We have a substitute that I would like to move.
We have a motion that's been properly seconded for a substitute. All in favor say aye. Aye. Any opposed? Substitute is before us.
Thank you so much, Mr. Chair. This bill directs the Department of Medical Services to amend its regulations to extend the time limit for appeals of eligibility determinations. It also directs that department and the Department of Social Services to amend their regulations to create a mailing time period for communications related to Medicaid, the Supplemental Nutrition Assistance Program, and Temporary Assistance to Needy Families Program. The subcommittee recommended reporting with substitute by a vote of 7-0, and we have now learned it needs to go to appropriations, so we'd like to report with substitute and refer to appropriations, and I so move.
We have a motion that's been properly seconded to report with substitute and refer to appropriations, HB 1240, and we'll go on the board. And HB 1240 reports with substitute and will be referred to appropriations by a vote of 18-2.
So the last bill before us is House Bill 1284. And this bill we had earlier voted to incorporate House Bill 87 into it. So I'd like to move this bill as a substitute with that substitute.
We have a motion that's been properly seconded for a substitute for HB 1284. All in favor say aye. Any opposed? No. That's before us.
And I believe I described it earlier, but maybe there were so many bills and I forgot, so I'll do it again. This bill directs the Department of Medical Assistance Services to modify state plan provisions covering provider-to-provider consultations to also include patient-generated consultations. The bill specifies that consultations provided through telemedicine services, including audio-only telemedicine services where applicable, shall be included. And the committee recommended reporting with substitute, referring to appropriations by a vote of 8-0, and I so move.
We have a motion that's been properly seconded to report HB 1284 with substitute and refer to appropriations, and we'll go on the board. And that passes by a vote of 20-0. Thank you, Chair Tran. Thank you to all our chairs. You had a lot of bills to get through there and a lot of votes, so really appreciate that dialogue. We're going to immediately adjourn this meeting and then pivot to our Health Subcommittee meeting, which also has a full docket, and Chair Hope is ready for us. So with that, we are adjourned. Thank you.